Let's get an update now on the situation at Chris Hani Baragwanath Hospital. That's after workers there embarked on a picket. They're demanding that the provincial government renew all contracts of health workers employed to help mitigate the effects of COVID-19. The Gauteng Department of Health has this afternoon released a statement saying it will not be able to renew all temporary COVID-19 posts due to budgetary constraints. The department continues to say that it would have liked to retain all temporary COVID-19 appointed staff. The current provided budget by Treasury to pay for these posts is unfortunately inadequate to keep all workers. The GDOH has received a COVID grant budget amount of 2.2 billion rand for compensation of employees to respond to the COVID-19 pandemic. The budget enabled the department to appoint critical staff required for since 2020, rather, on contract, and that's part of the statement from the Department of Health. We get reaction on this. We're joined by Dr. Aslam Dasoo, convener of the Progressive Health Forum. Always a pleasure, Doctor. Thank you very much for joining us this afternoon. So perhaps your initial thought into the events that are playing themselves out. Earlier, our reporter Malungelo Boy coming to us from Baragwanath Hospital saying that some of the staff members have had to even take money out of their pockets to buy food for patients.
Good afternoon. Thank you for inviting me. This is a lamentable situation in any given environment, as you are obviously aware. Now, there are a couple of issues. You mentioned the issue of the COVID-19 temporary posts. Well, just one thing about that. Only 50% of those posts were filled. The money was allocated for many more posts, and that money is gone. We're not sure how. But I think that part of the protest by health professionals, and that's important, that they're not just the working staff there, it's the health professionals as well, is about that, and the mortifyingly embarrassing situation that patients are not adequately nourished at a major hospital in a major city. And this, as well as issues related to waste disposal, poor management, and a number of things, can all be put at the door of the Gauteng Department of Health, the GDOH you mentioned in your opening. And when you do that, you begin to see a pattern that's been in place for the last 15 or 20 years under successive MECs who, for one reason or another, somehow contrived to degrade the public health system in Gauteng, the most complex and comprehensive health system on this continent, which is in a state of sorry disrepair.
Just yesterday, the Finance MEC Nomantu Nkomo Ralehoko revealed during her budget for Gauteng at least that the Department of Health or Health and Education in the country as well as infrastructure will get a lion's share of that budget. Do you perceive it's a budget issue or it's a management issue?
I'm quite certain that the primary fault lies in the management of the budget. I can't talk to the budget that was announced yesterday, but this is an annual thing, and I'm not sure how they prepare these budgets. But Gauteng gets the lion's share of the provincial allocation. And we have 5 teaching hospitals in this province with a number of secondary hospitals and clinics in a very populous area. And, one would expect that the budget would fit the needs of these facilities. Evidently, this is not the case. And if you go to any number of hospitals, you'll see deficiencies that wouldn't be tolerated in any other country of a middle-income country. It's quite shocking what's happened. If I may, we have the Charlotte Maxeke Hospital, which, as you're aware, suffered a huge fire about a year ago. To date, this hospital has not been repaired. And we find out that 10 months of this period has been spent bickering between the Department of Health and the Department of Infrastructure, the latter insisting that it will cost, I don't know, I think it's a figure of 1.7 billion to fix, which is inordinately high. And, of course, the Department of Health doesn't have the money. And so they basically did nothing. And patients have suffered the consequences of that. I can assure you that we are seeing on a daily basis, as a result of the closure of Charlotte and the fallout from that onto the rest of the system, deaths, just deaths, of the order of a life Esidimeni on a daily basis. Now, you know, there's no possible way to justify something like this, no matter what they say. And the worst part is that these things can be prevented by rather straightforward common sense management. We suspect that even though the Department of Health gets a major budget injection every year, a lot of it is misspent, it's wasted, or lost through corruption. The President himself appointed a special unit to look at corruption in the health sector, saying its budget, and that would include all the provincial budgets for health, is the one which is most victim to corrupt activities.
If you speak to anybody that has ever needed help from Chris Hani Baragwanath Hospital, you'll have those who say, what amazing people that I found. There were pockets of that, right? And then you have an overwhelming sense of people who will tell you, I went there at 3 a.m. in the morning, at 2 a.m. in the morning, because, you know, you need to get there early. And even then, you know, doctors will see you much later in the day. Sheer inability to handle the number of people that come through. You highlighted the ripple effects of all of this, chief amongst which is death. Is this as a result, you perceive, of doctors who will then leave the country because they have no choice?
That is already happening. Look, there are two things here. When you take out an institution like Charlotte from the system of care that we have here, it's quite a shock to the system. Now, the other hospitals pick up the fallout. They can do so for a week, 2 weeks, perhaps even a month. But for a year, what happens is that the additional patient load, without the requisite support in terms of facilities and staff and so on, means that those facilities get damaged. So now we have systemic damage that will take years to repair. The emergency department at Helen Joseph alone has on average about 40 acutely ill psychiatric patients on a daily basis lying in the emergency ward where trauma victims are treated, you know, maternity patients come in labor and so on, and you don't have the capacity to manage acutely psychotic patients who cause a huge commotion, harm patients, harm themselves, attack staff, and there's no capability that the department has put into that hospital to manage this. It's an ongoing problem. So there's your ripple effect. But the other important issue, and I'll just quickly highlight this, is that what happened at Bara today is groundbreaking, and I take my hat off to the clinicians who came out. Clinicians have been severely victimized by this Department of Health and warned not to speak out about the deficiencies they come across on a daily basis, that, you know, on pain of losing their jobs. I think clinicians, the doctors, the nurses, the pharmacists who stood up today to speak out must be supported. And I think we as PHF and collegiate organizations that we work with will support them and show solidarity with them. We expect that this will now occur in the other hospitals, because it's not just Bara, it's all of them. Because there's one Department of Health, and all roads lead there. So they need to step up and tell us why they have failed so miserably, the people of Gauteng.
This is quite scary, and COVID-19 highlighted at the height of it, where there was no difference between a public hospital and a private hospital. Whether you had medical aid or not, sometimes you would need to go to a public hospital, and therefore speaks to all of us as South Africans making sure that this works, because it touches each and every single one of us. Then comes the conversation of the national health insurance for South Africa. With everything that you have highlighted, I can tell you there's a number of people who will say, I don't vote for that because our health system is so crippled.
Yes, I think I'm one of those. And there are huge policy problems with that. But just to address the issue in this context, 95% of public health facilities cannot be accredited for NHI services. So think about that, 95%. I don't know how and when these facilities will be upgraded so that they can be accredited for NHI. Now, just that problem alone puts in serious doubt the push towards NHI. You have a huge budget for public health, and it's misspent. There are 9 provinces who each get this big shot of money, and then the money gets managed in 9 different ways. But where it doesn't go is into the services. So the residents of Gauteng now have their premier hospital, Charlotte Macrae, practically out of action. It does take on some patients, but with the 2,000 cancer patient waiting list, and those patients die because they just can't get services anywhere else, and a whole host of patients having to be pushed to hospitals like Chris Hani Bara, like Helen Joseph, without a commensurate increase in staff, is going to cause burnout among the professional personnel. So make no mistake, our professional personnel are highly trained. They are highly sought after around the world. And there's really nothing you can tell them to convince them to stay when they are working in such horrific conditions. Walking into an emergency department at Helen Joseph in the most industrialized city on the continent is like walking into a medieval horror today. So, residents of Gauteng need to ask their government here what they intend to do about it, but more importantly, why did it end up like this?
Just finally for us, Dr. Dasoo, how sustainable is it that we have public health care versus private health care in this country? How long can we afford to keep that up?
Well, look, the issue really is that private health care has grown at an accelerated pace, not least because the public health system has been increasingly degraded. So people have voted with their feet. They're going to pay eye-wateringly high medical aid premiums to get private care, and they do get it. The private sector is capable of doing that, but it grows, it's very expensive, it's very exclusive. The health market inquiry, which took 5 years and a lot of money, initiated by the Competition Commission, highlighted certain things that need to occur, regulations that need to be applied to the private health sector. Rational, proper regulation occurs everywhere in the world. The government, for 10 years, did nothing about that. Nothing. On the other hand, they continued to mismanage the public system. So, now they give us the thin gruel of NHI, which is just a fund. They want to take all health spending, put it into a single fund, overseen by a board appointed by one minister. 500 billion rand a year. Honestly, who can take that seriously? It doesn't work. So what needs to happen is a single-minded focus by the government on the public health system. It's the people's heritage. It has the capability of being a fantastic, well-distributed system, employer of choice, care provider of choice, if we want it to be, and properly regulate the private sector so that it doesn't, have deleterious effects on the public sector. I think if we do that, we're on the right path. But there's just no talking to the Department of Health about this. We've been at this for the last 30 years. I know the story, and I can assure you the government is not on the ball as far as this is concerned at all. Just imagine the MPs in Parliament will have to vote for the bill for NHI that will take away their very rich benefits.